questions. Why is it Governor LePage pounding the table over this issue? It's time to answer the tough questions. Who's taking responsibility? What is the plan to fix it? Maine people are waiting. Governor LePage, what are you going to do? Now I'd like to introduce Senate Majority Leader Troy Jackson.
Thank you, Ben. Hello, I'm Troy Jackson. I'm the Majority Leader in the Maine State Senate, and I'm here today to say enough is enough. For too long, Governor LePage has looked the other way, while some of the state's worst scandals have taken place right under his nose, on his watch. When Mainers' lives are on the line, Governor LePage is nowhere to be found. He's silent, and for someone that likes to beat his chest and say, "Look at me," he turns into the invisible man. While news broke about the dangerous working conditions and abusive treatment practices at Riverview, Governor LePage was throwing fake temper tantrums about political debates. He should have shown up to do his job. For a man who's quick to tell others to take personal responsibility, this governor is either missing in action or passing the buck. For a politician who wants to run the state like a business, he's a bad CEO. He squandered taxpayers' dollars, he's refused to play by the rules and the law, and he's rewarded incompetence like Mary Mayhew with bonuses and vacation time. And for a governor who brags about being a turnaround specialist, the only thing he's turned around on this state is his back. Governor LePage is leaving a trail of mismanagement behind him. And so yesterday, the legislature did something. The Government Oversight Committee took the first steps at beginning an independent investigation of Riverview. But it's not enough. Mainers expect a leader who will fight for the safety of workers, and a leader who will stand up for the rightful treatment of people who may not otherwise have a voice. Right now, as we stand here across the river, for both the patients and the workers at Riverview, their day will surely be another dangerous and dysfunctional one. After 4 years, we've seen Governor LePage's own track record that we are not his top priority. He's turned his back on us. Mainers expect a governor that we can be proud of. In fact, while the whistleblower lawsuit of the Maine CDC tells us that members of LePage's own administration are willing to cover up improper behavior in the workplace. As the CEO of our state, LePage has created a culture of corruption, a lack of transparency, and this mess at the Department of Health and Human Services. Governor LePage's own actions, or inactions, speak louder than words. Mainers deserve better. Mainers deserve a leader who will fight for them. Someone who will step up when crises arise. Today I ask you, Governor LePage, how are you going to protect Maine workers? Now you hear from my colleague, Representative Dick Farnsworth.
Thank you very much, Senator Jackson. My name is Dick Farnsworth. I'm the House Chair of the Health and Human Services Committee. And in that position, I have seen firsthand just how deep-rooted the mismanagement is at the Department of Health and Human Services. The ongoing crisis at Riverview is shameful. The governor and his administration have had their head in the sand from the very beginning. They have refused to acknowledge the serious problems at the facility or take responsibility. Instead, they shift blame to the federal government for requiring the hospital to meet basic standards that hospitals across the state and nation are meeting each day. As we've seen, the health and safety of workers and patients is at risk. The loss of our federal certification for Riverview is costing the state $20 million in federal funding each year. We saw the Government Oversight Committee take bipartisan action yesterday. Lawmakers must come together and hold the administration accountable and ensure that patients and workers are safe at Riverview. Unfortunately, Riverview is not the only problem that has plagued DHHS under this governor. From the Alexander Group scandal to the failed contracts for Maine Care rides, Governor LePage has allowed rampant mismanagement under his watch. This mismanagement has cost taxpayers millions of dollars while causing real harm to some of Maine's most vulnerable citizens. Patients at Riverview who have suffered abuse, elderly and disabled Mainers who have been denied services because of the failed rides contract, and children who have been put at an unnecessary risk because of the department's failure. And it all leads to one person, the Chief Executive Officer of our state. Governor LePage claims to be a turnaround specialist from the business world, but time and time again, he fails to manage his own administration. This chronic mismanagement has put our most vulnerable people at risk and has wasted millions of dollars in taxpayers' funds. It is unacceptable, and the people of Maine must hold him accountable on November 4th. Thank you very much.
All right, we'll take some questions if you have any.
Isn't the problems at Riverview or caring for psychiatric patients at the state level been a problem for decades? Isn't DHHS had a problem for decades? And it seems like the wall out of the administration. It doesn't seem like this matters.
However, I would say that you're probably right. This is something that has been going on for a long period of time. However, the whole intent behind Riverview was to begin to change that, number one. And number two, it would seem to me that when a new administration comes in and they have identified a problem area, then you develop a strategy for dealing with that. And that is something that has never really taken place.
I'd like to respond to that too. We didn't lose $20 million in federal funding until this administration took over. In over 12 years that I've been here in the state legislature, I never had state employees come to me and complain about not being able to make complaints and being afraid for their safety. I don't care what governor we're talking about. I never had anyone come to me complaining to me that they're afraid for their safety.
Can you talk a little bit about what Democrats have done or what your idea would be to fix Riverview other than a bigger report, a bigger investigation?
Well, I think the OPEG investigation will give maybe a longer-term reflection on what can be done. However, I think an initial action, because one of the concerns is around staffing and people having adequate staffing during periods of crisis. And if we took and increased the staffing to a level that is appropriate to handle, to allow for backup systems that will, so that when a crisis is occurring, there can be additional staff to move in to provide that support, I think it would certainly lend a hand to providing better staff safety and certainly patient safety.
There's something like that too. You know, OPEGA took the bipartisan approach to go in and do a study on that, and I was glad that that happened. But you know, this is a leadership issue. A leader would step in and demand accountability. I mean, I'm someone that's always been a worker advocate, and for, like I said, to go back to the fact that workers are scared for their safety, and where is the governor? I mean, we hear nothing on this issue. For someone that likes to talk a lot about things, we don't hear anything on this issue. So for me, it really is something that I'm concerned about, because I wouldn't want to be a worker put in that type of position. I certainly wouldn't want to be a patient put in that type of position.
Lost certification a year ago, though. The governor had made a statement, you said, where did the Democratic
Certification is one of those very interesting kinds of processes that is actually pretty significant because of the money involved, but also it's very basic. It is a floor, not a ceiling. And so, for the most part, it is not that difficult to achieve it. Had I been in a position of managing that situation, it would have been important to move in to the administration and take a look at exactly what the concerns of the CMS inspectors that we're having, and listen to their concerns. It's clear to me that somebody isn't listening very carefully to the issues that are being raised by CMS. And it's maybe simple things, such as the treatment plans are incomplete or non-existent. Yes, everybody should have an appropriate individualized treatment plan. That is standard practice. But that is one of the areas that has been missing, and apparently there's been some effort to try and correct that, but we're still falling way behind. But you need to take and listen to what CMS is saying, and in order to find out exactly what you need to do or what steps you need to take in order to correct the problem.
Representative Farnsworth, do you think that it's possible to satisfy the concerns raised by CMS as long as we continue to place forensic patients at Riverview? Isn't the ultimate solution freestanding unit someplace on the grounds of the Maine State Prison, and won't that be a pretty costly alternative?
That is a very interesting kind of a clinical question, and I think that probably that is one of the issues that needs to be discussed with CMS in terms of trying to resolve this problem. I'm not sure that issue has been thoroughly resolved, and I'm not sure we've been listening very carefully to what their recommendations are.
Didn't the legislature go along with the administration's plan, though, when they moved diverted funding from DHHS to corrections to expand the mental health?
We certainly did, and have taken steps in order to try and do that. However, I'm not sure that has really resolved the big issue, which is the overcrowding of forensic patients still occurring at Riverview.
Any more questions?
Did you see the change in leadership at Riverview earlier this year as a positive step by the industry?
That's a tough one. There has hardly been enough time to really get a feel for what the result of that will be. Obviously, administration at the program level is extremely critical, and we were obviously not functioning effectively with the administration that we had. So time will tell as to whether or not the new administration is going to do the job. But that is probably something that should have been evaluated some time ago, maybe within the first year of the administration, in order to begin to address the problems, which I think were fairly easily recognized.
Any other questions?